summarizing, I just want to say that I know we could all feel as if we could get lost in all of the indicators that we might want to address or feel compelled to address when we look at the challenges in our own localities. But we can't do them all, and there are some things that we should think about. First, I'll start with where Dr. Sondic concluded, which was with data. Something that I have said to my staff over the years is that we only know the data that we choose to look at. So not only is it that we need more and better data to figure out exactly what's happening and how we need to move forward with the indicators, we have to look inside our statewide data to really understand not what's just happening in urban and rural populations, but in specific population groups. We also need to identify our priorities before we start planning programs, which is a shift in the way many of us do our work, especially in state departments of public health. It's important for us to determine what we have capacity and support to actually implement. So we're talking about employing new initiatives and the correct strategic existing initiatives to address 2020. It's very important, as we've already talked about, to maximize our community partnerships, particularly as we focus on policy and systems changes to address the social determinants of health. And when I talk about regularizing program integration and collaboration, it's not just a matter of addressing chronic disease prevention when I'm talking about that, because for a lot of the indicators that we're trying to improve upon, the risk factors are shared ones. It doesn't really matter whether or not we, as a state agency or a local agency, are directly responsible for a particular program, such as tobacco, to address tobacco prevention and tobacco cessation. We have to collaborate across agencies. For us, that includes ensuring that we include our Healthy Homes programs, our work in performance improvement, our indicators for our Maternal Child Health Block Grant, our new, I'm happy to say, Community Transformation Grants, along with a number of ongoing DPH programs, with the hope that we'll also be able to preserve some prevention block grant funding to do some of this work. I'll go on to the next slide. We know that we have to exploit all the resources available to us and the partnerships within our state, and we work very closely with ASTO, NACCHO, NACDD, CDC, HHS for guidance and support as we do our work. What I said about Windham County reminds us that there's no particular race, ethnicity, language, or color associated with health disparities. So that's important for us to remember, because we know glaringly what we need to do to address racial disparities in health, but we shouldn't overlook what else we might need to be thinking about along the way. And then I'll just conclude by saying that for the past several years, I spent a lot of time thinking that one of my challenges was to help identify what the role of public health and health reform is. And I have two things to say about that, one of which I think Dr. Coase already referenced, which is that working on the Healthy People 2020 objectives is really advancing health reform. And then finally, for me, part of the brilliance of the Affordable Care Act is that public health is totally embedded within it. So there's no distinction between public health and health reform in that regard. I'll stop there to leave time for questions.